So when planning for a case with socket preservation, I'll typically give the patient a course of antibiotics. Beforehand, we'll also give them painkillers, paracetamol and or ibuprofen. We basically treat it like an implant placement procedure where they get a goodie bag with post-operative instructions, an ice pack and a week-long course of antibiotics. That's my personal style of covering and maintaining these patients, and it typically works well in my experience and my hands. I've experienced to date in 7 years of using Ethos no true infections or inflammatory markers coming back from using it in a grafting case. So to perform site preparation in managing these cases, obviously one, you numb the patient up, and two, you would carefully or atraumatically separate the gingiva or mucosa from the tooth, and as carefully as you can extract said tooth. Then sometimes I might raise a flap so I can visibly see what I'm doing. Sometimes I may not raise a flap and do everything through the extraction socket. This is preferable because it means less tidying up after and less pain and trauma for the patient, understandably. Personally, I also use hand curettes. I do have the drill-powered degranulation burrs. However, in my experience, I just prefer doing a bit of physical hand scraping. Once I physically have performed the thorough degranulation of the extraction socket, and I feel happy that the site has been cleaned and irrigated with sterile saline, then we can proceed to placing the wet, claggy Ethos into the socket, and then of course you have your natural drying out mechanisms with cotton wool to perform a nice chalky substance, which then we can suture over and ideally achieve good primary closure. Personally, I am lazy, so I use Vicryl Rapide, which is resorbable sutures in the hope that the patient doesn't have to return. However, if the patient ever does wish for a free review, then of course I'm more than happy to see them, but I remind them that I'd like to leave the sutures in for a minimum of 10 days before I take the sutures out again. But typically in my experience, most sutures will disintegrate and disappear within 2 to 3 weeks after the surgery has been performed. Patients also usually experience minimal pain and swelling, so in that regard it's normally a very pleasant, predictable procedure. The only concern one might have is if the primary closure is not perfect, then yes, a little bit of the solution or Ethos can start being lost and washed out around the wound edges.